You're listening to Heroes of Healthcare, a series about the bold, selfless, and innovative individuals who are serving our communities with compassion and care. This episode is sponsored by Jackson & Coker Locum Tenens. If you are seeking interim physician or advanced practitioner coverage at your facility, or are a practitioner who is looking for more work-life balance, visit them at jacksonandcoker.com to learn more about their services. Now, let's get into the show.
Welcome to the Heroes of Healthcare podcast. I'm your host, Tim Fisher. Today, we're excited to have Dr. Paul Earley join us. Dr. Earley has been an addiction medicine physician for the last 40 years and has a very unique perspective on addiction among healthcare professionals. He is the author of 3 books and numerous articles on addiction and its treatment. Dr. Earley has dedicated his life to helping physicians be healthy, productive people so they can help others. We are honored to have Dr. Earley on the show. Welcome to the show, Dr. Earley.
It's good to be here with you, Tim.
We're honored to have you with us today on Heroes of Healthcare. And I always like to start just getting to know so our listeners can get to know you a little bit. Can you share a little bit about your background, where you were raised, kind of the lens that you look at the world through when you were a child?
Well, that's a great question. I was born in Cincinnati, Ohio. I come from a medical family. My father was a physician. His brother was a physician. I was the youngest of 4. I grew up in a household where my father was gone quite a bit of the time. He worked as a surgeon in a practice that was busy, and I saw him every other weekend for a couple of hours. And he'd come home late at night and he'd be tired. But he was a strong, gentle soul and didn't have that kind of that tough edge that most surgeons had, at least not when I knew him as a boy. I could tell you more about that as I grew up later. So I grew up in the Midwest in Cincinnati, and then I did most of my medical training on the West Coast in Oregon, and then wound up coming down to Georgia for most of my entire career.
So you've been an addiction medicine physician for 36 years. You just shared that your father was a surgeon. How did you decide that you wanted to be a physician?
Oh, that's a great question, too. My original kind of life goal is I went to a college where even the undergraduates did research, and I was in the biology department doing research, isolating hormones and figuring out how neurohormones worked. And my life goal really at that time was I was fascinated by the brain. I was fascinated by biology and was headed for a career in primary research. I was doing most of this out, as I said, out in the West Coast, and my mother got ill with cancer. At that point, I changed my mind and decided I needed to probably come home because her cancer had recurred, and I knew that this was not a good prognosis in the era, 40 years ago. And so I moved back to Ohio, and somehow in my mind, I equated that with going to medical school instead of going in getting my PhD in neurobiology. So I went to medical school at the University of Cincinnati, and which was my father's alma mater, and had the privilege of actually working with him some of the time, both as a surgical tech and then in medical school for a bit. And that's when I saw the other side of him as a very firm, very accomplished man who was who really didn't show that at home, but he was a different man at work, and again, very gracious, but determined to do a good job. So that's how I got into medicine. And because of my research experience, I decided to pursue neurology and went back out to Oregon to do my neurology residency at the University of Oregon. This was, you said 36 years. It's actually almost 40 years now that I've been in this field. And back then, being in the addiction field was totally unheard of. It wasn't even, a field didn't even exist. But I had a somewhat interesting way of getting there in that I actually developed my own addiction disorder. And, I didn't know, and we didn't know really back then, that addiction is a genetic disease. I also found out that not only is medicine in the family, but also there was quite a bit of folks in my biological family that wound up succumbing to various forms of mostly alcohol use disorder.
Mm.
Not my father, luckily. So I myself got ill. And then when I got better, I decided that I was so fascinated by the trials and tribulations of finding my way out of the morass of my own disease that I really kind of changed gears. And my whole career is this amalgam of understanding the neurobiology and understanding the psychotherapeutic parts of addiction care and melding them in a way that made sense over the years.
So I want to elaborate a little bit on what you just shared, but going back to your mom is sick, you moved back to Ohio, and it sounds like to that point, you really weren't considering being a physician. Is that safe to say?
Yeah, and I think there's a lot of reasons for that. My father was, in some ways, a figure bigger than life. I recall walking down the streets of Cincinnati and people coming up to him and showing them their scars in the middle of the street, things like that. And he was kind of a hard act to follow. So, and again, the science part of it fascinated me as well. I've always been fascinated by basic biology. And so I thought that's where my career was heading. And that's why, the shift in medicine is a little unclear to me. But when people ask me, do you have any regrets about going into your field? I mean, it was a fascinating field. I did find that I have a passion for working with my hands. I probably would have made a pretty good surgeon as well, but that was not in my cards. And this clearly was.
Yeah, that's interesting because I talk to a lot of physicians and we've had a number on this show. And a lot of times the pull to become a physician is, I mean, there's a lot of different factors, but two of them that are very near the top are something happened to someone they loved when they were younger and they saw the healthcare profession and they said, hey, I want to be part of that. I want to help people like your mother, getting sick and moving back to Ohio and seeing people take care of her and help her. The allure of that seems to attract people to being a physician. And then sometimes it's in the family, to your point. My dad was a physician. My mom was a physician. I saw the impact they had on the community. I wanted to be that. It doesn't sound like it really was either one of those. It was kind of your circumstances. It wasn't like because your dad was a surgeon, you wanted to be a surgeon, or because your mom was sick, but you still ended up being there.
Yeah. And I really saw the value in a life of serving others through caring for them. So there was absolutely no doubt. It's funny, the rest of my siblings are either in the ministerial field or in medicine. So our whole family has headed in that direction, in my generation as well. So it's all about caring for others and being of service to others is extremely gratifying. And I think that was the pull. I thought how I was going to do that was in a more technical way, but then again, it shifted during that time. And I think my mother's illness might have affected it somewhat. That's still a little foggy in my head because, back in those days, there were no pagers. So my our phone would ring day and night. And we had two phone lines in our house when two phone lines were absolutely unheard of. So one phone line could be open at all times for calls for my dad. So, the household was definitely aimed around making sure that the care was provided for people, and the family was important, but serving others was a very important part of that process. And the family was organized around that. So going into medicine felt right from that regard.
We're very thankful that you did. And it's always fascinating to me on how people end up where they are. So let's fast forward and kind of pick up the story where you were talking. So you decided to focus on addiction medicine. And again, that was 40 years ago when it wasn't as prevalent as you see it today. And then you mentioned having a struggle yourself. Can you elaborate a little bit on that and maybe how it shapes the person you are today?
Sure. I think that a lot of people that actually early on went into this field, a lot of the doctors that were my fellows, that were some of the big names in the field that taught me, had suffered from alcohol problems, or, as we know with physicians, access to substances such as opioids or benzodiazepines, or occasionally even psychostimulants, make the disease a little bit more available, if you will, to physicians. And, both opioids and alcohol were part of my story. And what happened was probably a mix of the grief around my mother's death and figuring out how to cope with that. And part of that was just the fact that the genetics are so powerful that it felt like it fit. Drinking alcohol, would drink some alcohol and I would feel a lot of my anxiety about the world around me would slip away and that sort of thing. Or if I took several oral opioid pills, I would feel at peace. And whereas some people fell asleep with opioids, they would actually make me able to concentrate more. So it's some paradoxical effect. And pretty soon I was using both out of control in my residency program, and they asked me to take some time off. And I did. And there was also some urging from other organizations that at the time, because I was writing illicit prescriptions for myself as well. And they said, you can't do this. And all of that combined towards me going to get care. And by the time I, went to treatment, I felt like my life had fallen apart and I felt like I was useless. And a lot of that, caring for others, being of service to others, being useful in the world felt like it had slipped away because at the time, I thought that my career was over and that sort of thing. And luckily, I had some people around me that were incredibly encouraging. The executive director of the Oregon Medical Board took an interest in me, and he said, "Get yourself straight, and we'll help you. We'll help you return to medicine, but you need to take care of yourself," and that sort of thing. And I had other people who kind of had identified themselves. And at the time, again, addiction among physicians is a very hush-hush thing. So you can imagine the shame that I felt about being someone who was supposed to be compassionate about others, but instead became quite selfish, and my illness may turn me into a selfish human being. So I spent a long time in treatment and therapy, almost 7 months, getting better in terms of the therapy that I needed, and learned how to become a patient, which was also somewhat difficult for us as physicians. As you know, we don't make good patients. But I learned how to be a patient. I learned how to take advice of others. I learned how to take direction from others, which was, again, a great skill. I was always a little bit of thought I knew best about how to handle everything around me. And my addiction taught me patience, and it taught me how to learn from others, and it taught me how to take advice from others, and it taught me how to ask for help. So all that went down. And then, and actually at the time, there was an organization called the American Society of Addiction Medicine, which was a very small organization at the time. And now it's huge. And I joined that organization when I first got out. And really, it was my goal in life at the time in neurology was to go into academic neurology. And back then, if you had a tarnish on your record, any in academics was probably not a place where I could be. And I was given advice to say, you probably don't have a career in academic medicine. So I said, what else can I do? And again, the other part of it, there was no training in it. So I sought out some psychiatrists. I sought out some experts in addiction medicine. I got training by a psychoanalyst. I went and I was trained in 3 or 4 different types of psychotherapy. I had to cobble it together. And after a short period of time, I had developed a skill set where I was of some benefit to work in a treatment setting, which again turned out to be back down here in Atlanta. And I started working at a small treatment center down here in Atlanta, and I've spent my 38 years of career here in the Atlanta area, at first providing treatment. And you can understand, because I was fascinated by my journey, I thought, well, maybe I can help other physicians. So my career is really centered around caring for physicians with substance use disorders, because we get sick too.
Yeah, it's really an incredible story. And I think a lot of times in life, and we talk to our kids, and like you want them to go through life without failing or without making mistakes, or having all the answers to the test before they take the test. But many times life teaches us things that we weren't anticipating. And I can only imagine you're in residency and you have to go take care of yourself so that you can take care of other people, and how that experience has shaped you just as a human being, forget as a physician, and all the learning that you took from that. And you're probably much better at what you do today because of the trials and tribulation you had to go through yourself. Is that fair?
I think that's very fair. The whole concept of, especially about some of this, really everything in medicine, being a patient makes you a better doc. There's absolutely no doubt about that. But there was also a piece about the kind of spending time, a long time, being a patient and feeling like you had failed, that made the drive to succeed deeper, if you will. And the success, again, in this case, is to be the best doctor I can be, to be the best, to have compassion, to be able to understand others, and also to understand everything I could about, for instance, the neurobiology of addiction, which is kind of an area that I have a deep interest in. But the failure solidified, understanding the personal trauma of what it's like to be demoralized by an illness which takes over every part of who you are. It turns you into somebody else, literally.
Yes. And I think having gone through that yourself, I'm sure that gives you an appreciation for what the people that you're helping go through. So, kind of switching gears, but staying along that line, physicians in our country, a lot of times people think doctors, they drive nice cars, they have a great life, which many of them do. But physicians in our country, the well-being of our physicians in this country, the burnout rate, it's kind of staggering when you look at the numbers. Can you share just a little bit around the stress and the well-being that physicians are struggling with in today's world? It's not as easy as it looks from the outside, is it?
No. It used to be something with a physician that you went through this highly stressful medical school residency, and then you got out, and in essence, you had a job where there was, if you were a relatively good physician, you're kind of guaranteed a job, if you will. You didn't have to fight so hard, because there's always been a shortage of really quality physicians. And that's how it used to be. What's happened in the past, really it's been going on for quite a while, the past 20 years or so, is there's been a dramatic shift. Most physicians today, first of all, they finish their training in debt. And so they have to figure out how to pay back that debt. And that creates a huge initial burden. And secondly, physicians, who a physician is and how they are in their world is very different. In my era, and certainly my father's era, physicians were in smaller practices. They were in charge of that practice, or they were a partner in that practice, or they were a younger physician in a practice, and they would mature up into being a leader in a practice. And now medicine has become a very different world, where there's a large corporate element that tends to control the practice, and physicians become more of a cog in a wheel. And when you're trained to think independently, and then you get out and you are pushed into a position where you have to be part of a cog in a wheel, if you will, That's a very difficult transition. And that in and of itself is part of the burnout problem. And then you add to that the problems that we have in medicine today with things like COVID, things like dissatisfaction with physicians, things like social media, where one unhappy individual can really cut to your heart instead of coming to you and saying, I'm happy with you, which used to happen to my dad's day too. It used to happen to me early on. I'm unhappy with the care. And I'd say, what can I do to fix it? That's a way of working it through with a person. But when social media comes in, it becomes impersonal and really painful. So you take social media, you take the corporatization of medicine, you add COVID to it, and it's no wonder that the stress, burnout, and compassion fatigue with our physicians today are out of control.
Yeah, you talked about stress, burnout, compassion fatigue, and I wonder as that has gotten progressively worse for physicians, and you work a lot with physicians, how has that impacted the number of physicians who are dealing with addiction?
It's unclear. That's a really fascinating question. I mean, the question is, gee, are more people ill with addiction? And I think the data is probably saying maybe a bit. But what I will tell you now, by the way, my career is I run the Physicians Health Program in Georgia, which is I no longer am the care provider that helps people get better. I'm the intermediary between the physician and licensing agencies such as a medical board in the state of Georgia that helps that physician return to practice safely and ensures the public is safe. That's my current job. So I see this every day. But what happens, I think, in terms of the physicians that we care for now is the cases are more complex. Whereas I used to see physicians that had a simple alcohol use disorder or maybe a problem with opioids, now I see a physician who has problems with insomnia, has problems with stress and burnout, and also has an alcohol use disorder. And all of that has to be managed at once. And I'm returning them to a high stress environment that is not what we used to have in the past. And so my work is very different now than it was, say, 10 years ago.
Well, you just mentioned your role now with the Georgia Professional Health Program. Can you elaborate a little bit on the Georgia PHP, what your mission is and what your focus is?
Yeah, I'm happy to do that. This is kind of the last stop in my career, if you will. I'm getting a little older. It's about time to retire. I've turned 70. So what the Physicians Health Program is, every state except for two, there's two states that don't have them, have a Physicians Health Program. So what a medical board does is they license physicians and they make sure the public is safe. And that's their primary emphasis. They need to make sure the public is safe. And how they do that is through the licensing physicians. And if a physician has difficulties, they sometimes, unfortunately, have to do something like reprimand them or even take away their license. And then we have the treatment providers and the physician themselves that are very interested in their health. And they have very different missions in the life. So there's the medical board, which has public safety as its primary goal. There's the physician whose goal is to get healthy and, return to work. But there's no intermediary between the two up until the time where Georgia had a Physicians Health Program. So I like to think that we're wall-eyed. We have one eye on the public safety, and we have another eye on the fact that physicians can get healthy and get back to work. And they can do that in a way where the public is safe simultaneously. So that's what we do. We manage that uneasy balance between public safety and physician health. So when a physician comes to us, the medical board is very supportive of what we do. We're a 501c3, not-for-profit organization. And we're a very small organization. There's really only 3 full-time people. I'm not even full-time there. But what we do is when a physician gets ill, and we also, by the way, deal with depression and some of the stress and burnout as well. When they get ill in any particular way, and if they come to us, and if they get the care that's necessary, the medical board says, we don't need to know about them. We're not going to take away their livelihood. We're not going to take away their license. And what we do is manage that balance between the physician and the medical board in a confidential way so that the physician gets the care they need. We don't provide the care. We kind of provide oversight of the care. We make sure they get there. We make sure that the physician is safe to practice from a cognitive point of view, from a health point of view. And when that's the case, then we say, you're good to go, head back. And then we also work with the healthcare systems, whether it's in Georgia, whether it's a Wellstar, a Piedmont, or an Emory. We work with those healthcare systems to make sure their physicians are healthy. And at the same time, the public is safe. So we're in that kind of, we call it that uneasy balance, the middle between the physician's need for care and the public's need for safety.
Do you see in your role, do you see a hesitancy from physicians to raise their hand and say, I need help?
Absolutely. And you've identified the key problem, because physicians are afraid that if they get sick in a way with either maybe even a depression illness, or maybe even they're burned out and they need to take some time off, if they do anything, they're worried about their practice falling apart. They're worried about their license being affected. They're worried about their board certifications coming involved. And that's our job, is to kind of help them do that. But they still are a little anxious to call us up. Oftentimes it's a spouse or it's a healthcare system. Sometimes physicians call us up. We have physicians call us anonymously, and they say, I want to know about your program. I said, happy to let you know. So we spend a lot of time talking with them anonymously so they can say, okay, it looks like I need this, and it sounds like you're interested in my health. Because if physicians can't get help anonymously, they're going to wait too long, which is the wrong thing to do as well, because then it's harder to get the care that they need, and at some point the public gets at risk. The same thing occurs, by the way, for airline pilots, which is the other group that I've dealt with. Airline pilots are in a heck of a pickle around if they have any stress or burnout, or if they have any depression illnesses. That's a very complex topic, and the category is called safety-sensitive workers. So what physicians are, airline pilots, nuclear power plant operators, police, and firemen, they're all safety-sensitive workers because their work affects the safety of the public, not just their own.
Well, what I love about your story is you not only are an expert in this field, and you're helping, I know when I talked to you earlier, helping physicians be healthy, productive people so they can help others. I mean, first of all, we need more people in the world doing that. Just period. It doesn't matter what profession there is. We just need more people in the world doing that. So thank you for what you do. But I do think there's a stigma associated with that. And what's incredibly important here is that you went through that yourself when you shared your story with us so you can relate to others. I think a lot of times physicians may say, well, yeah, you're just saying that because that's what you were told to say. You lived it.
Yeah, I actually, when I came to Georgia, I had to spend some time talking to the medical board. There was no PHP, and they had to get comfortable with my returning to practice first. So I knew what that felt like. It was darn scary. And at the time, it really fired me up to say, once I get through with this, I'm going to figure out a system so that we can get more people to say, raise their hand and say, I need help. If we increase it by even a small factor, I feel like we've had a success. And I think we've done that.
Well, you have. And I'm incredibly inspired. And I'm sure our listeners will be inspired by your personal story, but also the impact that you're making on so many other people who are caring. So I would say that you are my hero for how you have lived your life. I think that's what this show was started for, was to highlight people who are living their life and impacting others in a positive way. So let me finish with asking you, who's your hero?
Well, I have a couple of heroes, but I think the one I want to highlight fits in well with this story, which is my father and my mother. My father, in that he taught me the incredible meaning that comes from helping others heal. And He was a surgeon second, but a healer first. And he had a way, I had the joy when I was a medical student to watch him work and realize that giving to others is profoundly meaningful. The giving that comes from helping people, not all, you didn't help it. He didn't help all of them. He did his best, obviously, but that piece. But what was so interesting about that in retrospect was the fact that my mother, who was a very smart woman herself and very organized and very, in many ways, a little more clever than my father was. But what she had to do was she had to create this system around which he could actually work himself very hard and yet be supported. I was alluding earlier, I tell this story to my kids sometimes, there were no pagers or anything. So what happened was, like on the weekends, if my father was making rounds, she had to be at home in front of the phone because hospital A would call and it would get routed from the office to the home phone. And she would say, okay. And then she would call hospital B and say, can you page Dr. Earley? And I would watch her work, not only with her volunteer work, she actually did some amazing work in her volunteer work, but also to figure out how she could coordinate that and then deal with 4 kids, which is, a lot. And I think I was kind of a handful. So, but it was the combination of those two working together that was so impressive. And my mother's organizational skills in helping my father be able to work extremely hard with, on call every other night for really his entire career. He was in practice with his brother. And the two of them needed people behind them. And the combination of my father and my mother were really dedicated to caring for others. And the family was such as that. I mean, we as kids kind of knew that was what life was all about. And they taught us that in a way that meaning comes from caring for others.
That's powerful. And I think, as happens in many cases, that's the definition of teamwork, and that's a successful relationship. And it almost sounds like your family had a mission statement growing up. And when you grow up in that type of environment, you can't help but want to go out and make an impact on the world. So we really appreciate your time today, Dr. Earley, and we thank you for joining Heroes of Healthcare. And thank you for everything that you're doing to care for our caregivers.
It's been my pleasure. And as I said, it's been a great career and I love what I do.
You've been listening to Heroes of Healthcare. If you enjoyed today's episode, please tell a friend or leave us a review wherever you get your podcasts. You can also visit us at www.heroesofhealthcarepodcast.com for more information or to listen to past episodes. Thanks again to our sponsor, Jackson & Coker Locum Tenens, providing interim physicians and advanced practice staff for over 40 years.